the wrinkles and your facial expression. And if you want to see facial expression, then you see Bengali channel TV, the different episodes. You can see different actors, মানে শাশুড়ি বৌমা, and the hero, the heroine, in one frame. You can see the different types of expression in an episode in your TV channels. And also, even amongst you, even me, we had a bhang chidra, eram korlam, rege gelam. So expression, at least more than 41 muscles that is involved in different types of expression. Amar, you at a signal, the best thing is that your expression to a signal from your friend or anyone. Now, introduction. The forehead is common to both face and scalp. You just do like this. There is the muscles involved from the scalp. And you can see skin of the face, very vascular, rich in sweat and sebaceous glands. Skin is lax on greater part of except the nose and the auricle. Now this skin of the auricle and the nose, they are more attached, and it is not, you cannot pull the skin, but you can pull this thing like this. But you can pull the ear. কান ধরে টানতে পারো, কিন্তু তুমি গলার এটা টানতে পারো, কিন্তু স্কিনটা টানতে পারবে না। You cannot pull the skin from the auricular cartilages, but from your neck, if you want to pull, you can pull the skin like this. Okay? And the skin is lax on greater part of the nose and auricle, but very vascular, rich in sweat and sebaceous gland. Now, in this hot summer, you see I'm perspiring, especially in the face. And receive the insertion of facial muscle. The skin over here receives the insertion of the facial muscle. That's why in any burn, deep burns, or any like একটা steamed bucket of water, you get burnt, you get scald. That's a thin layer of the skin. But if it is deep, then the muscles are inserted on the skin, and naturally there is deformity, post-burn deformity. Superficial fascia. Skin, superficial fascia contains facial muscles, vessels, and nerves and fat. Now, deep fascia is absent except deep fascia in the face is absent except auricle, parotid gland, masseter, facial vessels. The buccinator muscles, the buccinator, Now muscles of facial expression. You see the different muscles and their different expressions. You can see different expression. The 15 type of expression is in this picture. And you might have a chemistry between your friend that you wink like this and she winks like this. So go for a biryani trip. Okay, now face, even the greater part of theatre. Mime, you know, mime. It is a expression, Kathakali dance, all forms of dances. They are with the music. Their facial expressions depicts what the dancer wants to say or convey. Okay? Now muscles around the orbit. The orbicularis oculi, orbital, palpable. Yeah. Depressor supercilii, corrugator supercilii, occipitofrontalis, levator palpebris, superioris. Now, orbicularis oris, oculi, origin orbital part of the medial palpebral ligament and adjoining frontal and maxilla, palpebral part within the eyelid. Action acts as a sphincter of eyelid. Action acts as a sphincter of the eyelids. Palpebral part closes the eyelid gently. The contraction of entire muscle producing radiating skin folds from lateral angle of the eyelids to so-called a crow's feet. The lacrimal part draws lacrimal papillae medially and dilate the lacrimal sac, thus helps in transport of tears. Paralysis of muscles produces drooping of eyelids, extropion and epiphora. Now, the paralysis. Now, if there is a stroke, cerebral stroke, if a patient comes and you see, you do a clinical examination, আপনি চোখ বন্ধ করুন, close your eyes and you try to just do this. Then you see the side which is paralyzed, then it will just be loose and lax, but the other normal side, it will close. Okay. Now, muscle attached to the nose. Muscles attached to the nose, nasalis, procerus and depressor septi. Nasalis, procerus and depressor septi. You can see different small muscles. That's why any injury, any trauma, it can be a sharp wound, it can be burn, it can be a bruise. When it comes to the emergency, please take your utmost care to attend that patient. Especially selecting of sutures. That's a big cut. You need a small, thin sutures for the skin. Because it will definitely, every wound will leave a scar. So, but you have to handle. In the scalp, you can give a mota basta shelai. You can give anything, it will be covered by hair, but the face, you be gentle. If there is any cyst or lipoma or small mole, of course there are these moles and small epithelial tumors. There are lasers you send to the dermatologist, because you don't try to cut with a big scissors or something like that. Because in the cosmetic bazaar, the worldwide, you can see lotions and different types of makeup. It's just to make that face beautiful. On your wedding day, you will be having a beauty parlor You go to the beauty parlor, they will change your face to some extent, your hairdo and your facial, this thing, and makeup. So you have to be very gentle attending a facial injury because of the different types of. Now, if there is a big accident, if the artery here is injured, then you have to take care. But you can put a bandage, tight bandage under anesthesia, that has to be repaired. And if you work in a hospital, in a plastic surgery department is there, then you call in the plastic surgeon also. It will be a teamwork. Now, actually, the trauma around the face will produce disfigurement. It will be if you like lip injury, you please manage with fine sutures. 30, 40 with cutting needle, and also now you see the muscles of lips and cheeks. Now, orbicularis oris, sphincter muscles of the mouth, elevators of the upper lip, zygomaticus minor, levator labii superior, levator labii superior alignasi, levator angularis oris, zygomaticus major. You can see the expression. See, like that. And you will see a smile. I think at this time I'm not smiling, but I'm telling you, like mimicry, and you just do that expression. Okay. Now, these small minor muscles, I think you would be asked in your osteology. It might be a major muscle, that is the elevators of the lip. Now, these you have to know. Depressors of the lips, depressor labii interioris, platysma, depressor anguli oris mentalis. This is the platysma up to here. That's why if you have to attend a burn patient, then accordingly you dress the wound, and also you might need the neck. You inspect and see how much the platysma is injured, and you put for this area, you put a collar, and if you are not putting in emergency, you won't get a collar immediately, then you bandage, you suture, bandage. There's no question of sutures in burns. Okay, immediate in the attendant. And I heal by honey. Actually, honey is an agent that it's a mysterious agent because it forms minimum scars. And early exercises. You have to, recently a boy got burned in the face and the hand, accidental burn. So, and also see, he has tattoo. Actually, tattoo is in the deep part of the skin. The epithelial layer, he got scalded and he got burnt, and some places there was deep burn. And he has tattoo in the right side, mom, right side, dad, and his girlfriend came, girlfriend or fiancée, you can say, that day for the dressing. She was present also. And I joked that, "Tor naam type ekhane debe." Now in the center will be, I told that guy that when you get healed, you have a name of your wife. And in his knuckles and hands, there was one Hanumanji over here. That portion is not burnt, but the other portion was burnt. And early exercises. Why I'm telling you this? See, you early you not deal with pain and this thing. You try to like drink water, you give water, then you have to তুমি নিজে দেখাবে হাতে any burn, early exercise, and you do this, that, mimicry. You do different types of your facial expression that you are observing and in the burn, and see this plasma, if it is to be after dressing, you put a collar, and again frequent after 2 hours, 3 hours you open and you try to make her exercise like this. So it এরকম করে থাকে. You see many burns like this. If it is a deep burn or badly managed burn, a deep burn badly managed. Not the doctor concerned is not saying that you have to do exercise, you have to do this thing. If you are a very busy doctor, you tell your assistant, you train them and tell that you show them. And so that's why you see in the when you are traveling by rail in different stations like this, it's so totally the facial expression muscles, small muscles are in the skin. Naturally, that gets injured. Okay. Now you see retractors of the angle of the mouth. See retractors of the angle of the mouth, zygomaticus major, depressor anguli, oris, risorius, plasma. Dracula. Okay. Now the buccal, the facial artery here, infraorbital, supratrochlear, and supraorbital, and this is the superficial temporal artery. Now, this is important because small tumors in the eyelid, it can, so what happens when you are performing a surgery of the face, then you ask your assistant to press so that arterial supply is to some extent is by, it will be controlled, it will be diminished, and you can suture. Even if you have any, the other day when I taught you scalp, then what you do is you tie a small tourniquet with band of silicone band tight like this, and temporarily you give sutures so there won't be a pool of blood or messy. Okay. Now see the facial artery, the infralabial, supralabial, and lateral nasal, and this is infralabial. This is the facial artery. Now, if there is a profuse bleeding by some injury or some mandible road RTA, road traffic accident, then there might be a very deep cut. So you have to manage accordingly, and so you have to, very important to know the facial artery and its branches, intralabial, or any small tumor in the lip. You have to locate and see. You can see the pulsation like this. You feel your pulsation like this. Over here you see the pulsation, and then accordingly you manage. Superficial temporal artery. See, that is the, if you see it like this, see it's pulsating, you see it will like this. Temporal muscle is, you just quench, and you see, and you can see the pulsation. Even aged people who is having hypertension, you can see the pulsation of the temporal artery, and also the now transverse facial artery. This is transverse facial artery. Parotid duct. This is the parotid duct. Now these are the places you have to locate in an accidental injury or your any surgery of the face. You have to be very much, because you handle the tissues and the vessels in a very gentle. Okay. Now this is the parotid duct. এটা কি করবে, তুমি ধরো সুইচার দিয়ে দিলে, ভেঙে দিলে, it will swell up. Then again, see the maxillary vein, superficial temporal vein, retromandibular vein, facial vessels here, and this is the vein over here. The jugular 6 is the internal jugular vein. Posterior auricular vein, superficial temporal, maxillary vein. Now this is the maxillary vein, superficial temporal vein, the retromandibular vein, the venous drainage of the face, and you can see the anterior division, the posterior division, plus facial vein, posterior auricular vein, and common facial vein. These are all contributing to the common facial vein. Got it? External jugular vein, internal jugular vein. Now, the cavernous sinus, emissary veins, pterygoid venous plexus. Now, see supratrochlear vein, supraorbital vein, to superior ophthalmic vein, it goes to cavernous sinus. The facial vein, here is the facial vein, deep facial vein, it goes to deep facial vein, and pterygoid venous plexus. It's an emissary vein that goes into the cavernous sinus. And see the deep facial vein here, you can see the orientation. You just draw some picture when you are studying. And you draw your level, now the cavernous sinus here, pterygoid venous plexus, this is within the skull, and this is in the pterygoid region, the pterygoid plate in that portion, the superior ophthalmic vein, and facial vein. Now the facial vein, see the deep facial vein, superior ophthalmic vein. Now pterygoid venous plexus, emissary veins, cavernous sinus. You can see which contributes, what are the vessels, the veins contribute to the facial vein. Now you see this picture, how they are draining the total area of the face. Now dangerous area of face. Now see this part. Sometimes you get a pimple, it gets infected and sepsis is there. It will be, your lips will get swollen up in this area. So you have to manage with very good antibiotic, very good anti-inflammatory agents. And just because the facial vein is devoid of valves and rests directly on the facial muscles, the movement of facial muscle may facilitate the spread of septic emboli, infected area of upper lip or lower part of nose, retrograde direction, and cause thrombosis of the cavernous sinus with serious complications. Hence, the upper lip and adjoining nose lying between the angular and deep facial vein forms the dangerous area of the face. That can be a 5 marks question, the dangerous area of the face. So you please, you draw that picture, you sketch, that can be, you get it like this. Just draw, illustrate, label, and you write a short note, 5 marks or 10 marks or 8 marks, whatever it is. It will depend on the dangerous area of the face. The facial vein is devoid of valves, and rests directly on the muscles. The movement of facial muscles might facilitate the spread of septic emboli on the infected area of the upper lip and lower part of nose. Retrograde direction cause thrombosis of the cavernous sinus and serious complications. Hence, the upper lip and the adjoining nose lying between the angular and deep facial vein form the dangerous area of the face. Even you see some people, it's a common thing in saloon or salon, whatever you say, salon, now you say salon. Okay, now you go for a shave, a gentleman goes for a shave, and from there he contaminated, the infection comes. So the next day the swollen comes to you, but you have to be handling that person, assuring him, and you give good analgesic, good anti-inflammatory agent, and plenty of water to drink. And in case that now he fears, because it's really pathetic, and opening the mouth. Okay. Now what I'm telling you that any injury in the face, you have to guide that patient that frequent warm saline water gargle. Okay, or you take, you cannot like expand, but you can give a sip of this water and you can fill it away. Another thing is that because it is not the medicine which will treat. 20% medicine, 80% is overall your management, how you are giving exercise and saying something that will give the confidence to the patient. And accordingly, you have to handle, and you have to know your anatomy. Now, the lymph drainage of the face. Now, this is the parotid lymph node. This is the facial. This is submandibular, submental, superior, deep jugular, middle, deep jugular, inferior deep jugular, supraclavicular. Now, this can be another 5 marks question. And now, many mothers or the parents will bring their child with some swelling. or some swelling in the parotid glands, the preauricular lymph node, in the mastoid lymph node from the scalp draining infected, that's why the lymph drainage is there. You can palpate, they will just point to you with and show you. So again, you have to manage accordingly and see, and you know the location. Now a patient with some swelling, then you have to examine her, him, you put a tongue depressor, any oral pathology is there. If there is a swelling, it can be, you ask that when you are taking like sour, then there's lots of saliva and secretion. Sometimes what happens, if there is a calculi in the parotid gland or submandibular gland duct, then you ask if you bring in your clinic. What I do is that I bring some Imli lozenge or Hajmola lozenge, not Hajmola tablet, or some poppins. These things that give lots of saliva secretion, and that swells up. And you can even palpate the gland. When you are palpating the glands, you have to be on the. We in a clinic, we just but ask the patient, and you, from the posterior end, you just palpate. The patient will be seated like this. On the back, you will just put your hands and then see what are the swelling, and if it is the submandibular gland swelling or is it lymph node swelling. If you have any, but you have to give a treatment for that inflammation. So you give antibiotics and other anti-inflammatory agents, and then go for a USG. Also go for your fine needle FNAC, fine needle aspiration cytology, and also you have an USG done. It might be for thyroid, it might be for the glands, and also if there is you are suspecting that if there is a calculi in the gland, then you do a xylogram. It's a dye that is injected into the duct, and they'll see if there is what is the obstruction, where is the obstruction. So it becomes easier for the surgeon to operate. The ENT surgeons, they handle these cases. Okay? At least your diagnosis, your illustration in the your pad, letterhead, you send it to any person. They'll be you're in MBBS. Say you're in MBBS, but when you give that, he or she won't have any chance to say you're wrong. So lymph drainage of the face, lateral part of the face, parotid lymph nodes, medial part of the face, submandibular lymph nodes, central part of the lip and chin, submental lymph nodes. Okay. Nerve supply of the face, the sensory trigeminal, except the area of skin on the angle of the mandible. The trigeminal, the angle of the mandible is here. Okay. Here. Okay. Now, except the area of the skin in the angle of the mandible, motor, facial nerve except masseter. Is the facial nerve supplies except masseter muscles. The facial nerve, you can see the facial nerve, posterior auricular, temporofacial, to digastric and styloid and cervicofacial division. Now you hold it like this, nerve supply. You can see, you just see the hand like this and put it in the face, and you will be, it will be easy for you forget. Memorizing you forgot in the exam hall. Then immediately you just pause and you see for yourself. This is the temporal, this is the eyes, this is the zygomatic, this is the buccal, this is the mandibular, this is the cervical. See the areas, the dermatomes, according to the dermatome, and that is having these nerve supply, that is the ophthalmic nerve, maxillary nerve and mandibular nerve, great auricular nerve. Got it? Now, trigeminal nerve, the ophthalmic, sensory, maxillary sensory, the mandibular V3 and motor, the mandibular V3 and motor trigeminal nerve, the ophthalmic V1, maxillary V2 and mandibular V3, sensory and motor. Now you can see the ophthalmic branch, the semilunar ganglion, maxillary branch and mandibular branch. This can be a question of 5 marks. So you just, if you are short of time, you don't have to go to the descriptive part. You just draw a rough sketch and then you label them. And the previous 5th slide, which I showed you, you can see, to memorize and remember, that it becomes easy. Okay. Now you can see the different auricular temporal nerve, mandibular nerve, your zygomatic motor, infraorbital, buccal nerve, mental nerve, and the lacrimal nerve, intratrochlear nerve, external nasal nerve, the supraorbital nerve, supratrochlear nerve. When you see in your atlas, or in the at least many nerves can be, when they are dissecting the face or prosected specimens are shown to you, please have to time down. Prosected specimen that is in the thing that the teachers are demonstrating, you please give some time and locate supraorbital, supratrochlear, lacrimal, intratrochlear, external nasal, intraorbital, buccal nerve, mental nerve, auriculotemporal nerve, and zygomatico-facial nerve. Now, supraorbital nerve, supraorbital, infraorbital, and mental nerves. Here. Infraorbital, orbit, infraorbital, supraorbital nerve, here. Now, ophthalmic nerve, supraorbital and supratrochlear nerve, forehead and upper eyelid, forehead and upper eyelid. Lacrimal nerve, lateral part of the upper eyelid. Infratrochlear nerve is lower eyelid. External nasal, nose till the tip. Maxillary nerve, infraorbital, palpebral and nasal and labial. Zygomatico-facial, skin over zygomatic bone. Zygomatico-temporal, skin of temple. Mandibular nerve, mental, lower lip and chin, buccal, skin over buccinator, or Om Shanti.